On the front line of the NHS, staff warn of the unprecedented demand facing the health service. I'm at a major hospital in Birmingham to investigate the pressures on A&E and to speak live to the Health Secretary.
Good evening, this is the NHS 111 service.
And new questions tonight about the reliability and the safety of 111.
Also tonight, European judges rule life can never mean life for Britain's worst killers. Jeremy Bamber and two others are told their whole life sentences are inhumane. And Ed Miliband's historic pledge to end automatic union membership of the Labour Party.
This is ITV News at 6:30 with Mary Nightingale in Birmingham and Mark Austin in the studio.
Good evening from A&E at Queen Elizabeth Hospital in Birmingham. Now for the next two nights, we're live on the NHS frontline. Staff here talk about the crisis facing the health service in England. Even in a modern hospital like this, the pressures on A&E are quite simply unprecedented. In the last hour alone, there have been 4 major trauma incidents. Yesterday was its busiest day ever. It's an extremely busy day today. It's sometimes quite noisy. The 4-hour waiting target for patients is missed, we're told, at least 2 days every week. Now tonight, ITV News has seen exclusive research linking the rise in A&E admissions with patients unable to get GP appointments. And workers on the controversial 111 service tell us they don't feel sufficiently trained to deal with callers in need of help. We'll put those issues live to the Health Secretary, Jeremy Hunt, in just a few minutes. But for the first of our NHS Frontline reports, our medical editor Lawrence McGinty on the often traumatic life in A&E.
The resuscitation room is the scene of the battle between life and death. A desperate and, in the end, unsuccessful attempt to restart a heart that has stopped beating.
Is everybody in agreement?
Sheila, is that okay? I think we can jump.
Last year, 95,000 patients came through the front door of the Queen Elizabeth Hospital. That's what they call their emergency department.
No soot in the mouth.
The major trauma unit is just one part of A&E, but one of the biggest and most modern hospitals in the country.
At the moment it's partial thickness, but with the burns they can actually continue to burn.
I was given special access to the department for 2 weeks and saw that even here the crisis in A&E is so severe they struggle to meet the target of treating most patients within 4 hours. They're failing on 1 day out of 3.
Too long. Too long.
Since 9:30 this morning.
And it's now 6:30.
87-year-old Nora Gossage was brought to A&E by ambulance with pains in her neck and shoulders. She's been here 9 hours. She couldn't keep still for an MRI scan, so needed a conventional X-ray.
Oh, I just think that the people who come in with the minor injuries should be refused. If somebody came in to me and with a ring stuck on his finger, I'd say, oh, I'm sorry, can't put it in a freezer. You know, get it off. I've got other things to do.
Coming to A&E to get a ring cut off may sound incredible, but while we were there, 2 patients did just that in a period of only 2 hours.
Feeling breathy today?
But they're not all time wasters. Tracy Spencer has a rare form of MS which has left her partially blind. She's come 20 miles to get a strong drug she needs because the disease is flaring up. And she told me her GP is closed at weekends.
So you come here really because
Yes.
you can't get it from his GP?
That's right, yeah. Or a local chemist, yeah.
The days of when it was an accident or an emergency have really changed. The public's perception is that A&E is somewhere you can go for anything. And that might be for a prescription that they've run out of, which they could have seen the GP for, or it could be the fact that they don't have a GP or they don't have faith in the GPs anymore.
Ted Green could have gone to a GP when he injured his heel 6 days ago. He came here on a Saturday. Georgie Beckian could have gone to the GP who gave him antibiotics for a leg infection when it didn't get better.
No, here?
No.
No, no pain.
No, feel it like that.
From a patient's perspective, if I ask them, why didn't you go to a GP? And if the answer is that I can't get an appointment till next Wednesday or Thursday, or for the next 4 or 5 days, then I feel sorry for them as well. At the end of the day, we have to look after the patient. So yes, we do feel frustrated. We can't express to the patient. Can't say, patient, go away.
Is that going to come with us as well?
When life is at risk, the trauma team in the resuscitation room pull out all the stops. We expect that, and they deliver. For this patient, for example, who suffered a heart attack.
300 milligrams of aspirin, with 60 milligrams of Prasugrel.
But with the traditional winter upsurge in A&E admissions on the horizon, the fear is that resources will be stretched to breaking point and beyond.
Now, Lawrence, there's new research tonight, isn't there, linking people's inability to get appointments at their GPs with this surge in A&E activity?
Yeah, I mean, look around, Mary, how busy it is. Almost every cubicle here has got a patient in it, 17 ambulances in the last hour alone. And this research, I think, suggests one reason for why A&Es are so busy. What they did is they looked at every GP practice in England, and they looked at how easy or difficult it was to get an appointment. And they found that in the worst practice in West Yorkshire, 50% of the patients couldn't get an appointment within 24 hours. In that practice, 38% of the patients went to A&E. In the best practice, all the patients could get appointments within a day. Only 2% went to A&E. They're passing that evidence on to Sir Bruce Keogh, the NHS's most senior doctor who's carrying out an investigation into urgent care. I think it shows that if people can't get to see their GP, they come here.
All right, Lawrence, thank you. Now, the introduction of 111, the new out-of-hours service in England, is another major issue for staff working on the NHS front line. A poll for ITV News reveals that 57% of people are unsure even what the service offers, and 44% of them say it's easier to go straight to A&E with non-serious conditions than to call 111. Well, ITV News has also been contacted by 111 call handlers who tell us that they don't feel properly trained to deal with patients ringing the helpline. Lewis Vaughan-Jones now on new questions about 111.
They haven't had an accident and don't feel it's an emergency, but they are the latest arrivals at A&E at Queen Elizabeth Hospital. Christine Jones's son Tom has had an abscess for a couple of weeks. Last night she called 111 and they were sent here.
You should have to travel all up here when you've got a doctor's up the road from you, you know, and that. But obviously we've come here because you can't do anything else for Tom.
Good evening, this is the NHS 111 service.
So as the 111 phone lines ring, there are voices saying it's just not working. At the moment, 80% of callers speak to staff who are not medical professionals.
I'm going to ask you a series of questions. Some of them may not seem relevant.
Instead, they follow a list of questions. ITV News has spoken to call handlers concerned about their lack of expertise. We've disguised the voice of one person who's been through the training.
A doctor would be able to look at them straight away and use his skills that he's trained for 7 years to do, whereas we don't know really anything. We're just going by a computer system and hoping for the best, really.
Other call handlers contacted us saying they do not feel they have had the full training for this kind of role. And most of us failed, yet we had our hands held to ensure that we passed. Peter Dawson works in a 111 centre. He's a trained medical clinician there to support the call handlers. He says the system can work, but there is a problem.
Call handlers will always err on the side of caution. And in so doing, inevitably there will be an over-medicalisation and possibly, or in fact almost certainly, admissions to A&E that otherwise would not have taken place.
I'm absolutely enraged that patients have been risked.
The doctors' union, the BMA, say in some of the new call centres there just isn't enough medical supervision.
I have hard evidence of contractors who have got as few as 1 clinician to 40 call handlers. It's supposed to be 1 to 6 to 10. This was a ministerial decision to roll out. Mr Hunt, it's your fault.
Can I start by taking the phone number you're calling from?
Call centres like this one in Derbyshire are successfully helping patients. NHS England say on average they have 1 clinician for every 4 call handlers who are fully trained. And this new system means the nurses can focus on cases where their skills are needed most.
I've got one of the nurses on the line for you, okay? Thank you.
Lewis Vaughan-Jones, ITV News.
I'm now joined live by the Health Secretary, Jeremy Hunt. Good evening, Mr. Hunt. Thank you very much indeed for joining us this evening. Now, this is a wonderful state-of-the-art hospital, but even here, they're regularly missing the 4-hour targets, and they just say that there is a crisis. One of the consultants actually told us that. What would you say to him?
Well, first of all, Mary, good evening, and thank you very much for doing this programme, because I think it's so important that we recognise how hard our doctors and nurses are working in A&Es across the country now. I think they're working harder than they've ever worked. We've got 1 million more people going to A&E than just 3 years ago, and I think it's fantastic that you're recognising that. And look, there is a lot of pressure. The way the NHS works is that where there's a pressure point anywhere in the system, and you've talked about 111 and you've talked about GP surgeries, it ends up in A&E because that's the sort of the place of last resort. And what we have to learn from this is to have better alternatives to A&E, exactly as you've been saying in your programme, so that people don't feel that the only way they can get help when it's at the weekend or the evenings and when people are worried about their children, they don't feel the only option is A&E, because as you rightly say, we can't go on putting more and more pressure on these brilliant people who are working so hard.
All right, so Mr. Hunt, we're sort of in agreement then. People are using A&E, well, you say as a last resort, but I think what we're seeing is as a first resort. You know, they're coming with minor ailments, they're not able to get appointments with their GPs. Is it actually the government's fault? You cut to NHS Direct, didn't you? You cut walk-in centres. Isn't it actually the government policy to blame here?
Well, we take complete responsibility for what's happening in the NHS, and you know, we did need to improve NHS Direct, and the concept of 111 I think is a good one. You're absolutely right to say that we had some teething problems. It was only introduced in Easter, and actually particularly in the West Midlands that was one of the areas where we have had some teething problems. But the idea was to have an easy to remember number, and I think 111 is a number we can all remember, although not everyone will know it now if it's only been up and running a few months. But also to do something you didn't get with NHS Direct. Yeah,
I beg your pardon, Mr. Hunt. I just wanted to say 57% of our surveys say they don't know what it's for. 44% say no, they definitely prefer to go straight to A&E. They just don't get it. They don't have faith in it.
Yeah, well, it's only been going a few months, and it takes time for people to find out. And also we've had some operational issues getting it up and running. But the other thing that you get with 111, which you didn't have with NHS Direct, is that within a few minutes, if you need to, you can be put through to a doctor or nurse. Now, as I say, it's running now in 90% of the country, and we're meeting our operational standards in most of those places, but it's not running everywhere, and we need to do better. But I think when we get there, it will be a big improvement, because people will feel, well, actually, I could go to an A&E and I should be seen within 4 hours, but I could also dial 111 and speak to a doctor or a nurse within a few minutes, and let me try that out first, because...
Is there not a problem, Mr. Hunt, with 111 in that actually some GPs are saying that they don't have enough training, the call handlers themselves, people are not trusting it. Can you reassure viewers tonight that 111 is safe if they call?
Well, 111 is an improvement on what we had before, but I don't want to pretend that we haven't had some teething problems in some parts of the country. But the reason we want to get it right is precisely because we're trying to reduce the pressure on all the doctors and nurses that are surrounding you that are saying they've got that pressure.
OK. Mr. Hunt, I'm so sorry, as ever, we're defeated by time. Thank you so much for your time this evening.
Thank you.
Well, in a unique experiment, our website has been covering everything at this A&E as it happens throughout the day. You wouldn't believe some of the minor injuries staff here have been treating in one of their busiest days ever. They include stubbed toes, earache, minor burns that illustrate some of the problems, I think, facing the staff here. You can read all about them on our website, itv.com/news.